Good evening, everybody. Welcome to the first webinar under the aegis of NZUSI. The present council, led by Professor Shivam Priyadarshi, has a vision that we should be doing something for our youth. Since the COVID era is over now, and we will be starting with our physical meets now, the webinars can be accommodated to cover unconventional topics, which may be helpful for the youths in their future life. I'm very thankful to Dr. Ravi for extending a very warm hand, and it was very helpful in planning of this webinar. There was some little goof ups by me, but at the end, the meeting is now going ahead as planned. I will not take much time because everybody's time is precious. I will, since the meeting is by the President NZUSI, I will request Professor Shivam Priyadarshi to please start the proceedings. Thank you.
Thank you, Kamalji, and welcome on behalf of the NZUSI chapter of Urological Society of India. And good evening to all of you, and good afternoon to all those who are viewing from United Kingdom. So when I was in school in college days, I was brought up in Calcutta, in West Bengal. And there was a craze for doing training in UK. People would do FRCS urology, FRCP, MRCP, and all those things. Probably after doing their MBBS, they would just go to UK, get their degree, and come back. And most of these used to have a good practice in. Then I came to Jaipur, and I didn't know that whether this trend was going on or not. But recently, I have realized that yes, again, many people are doing MRCP, MRCS, and even FRCS, FRCP. So we will have a discussion on this. And we know from India, there are around 370 urology trainees who pass out every year. And this is increasing every year. So maybe in coming years, it would cross 500. So many of these young urologists might be aspiring for their career abroad, some in UK too. And some would be probably would like to do FRCS urology, maybe for reasons either to work in UK or even in Middle East countries, because they usually prefer FRCS urology more than our own degrees. So I think I welcome Dr. Ravi Bhatia and Dr. Iqbal Shergill to have joined us. We are really privileged and honored to have you, both of you. Both of us would enlighten us on how to have a career or how to go ahead in UK for job in urology, plus how to have a FRCS urology course. So thank you once again. And I would now request Mr. Dr. Anish to moderate the whole session. Dr. Anish, please go ahead.
I'm here, sir. Thank you, Shivam sir, and thank you, Kamal sir, for giving me the honor to host this session. I passed out from urology 8 years back, and I still remember distinctly that one of my juniors, started preparing for fellowship day one when he joined MCH urology. And he was successful. He was very successful. He got through France, and then he went to US, and now he's a consultant in US. So without much ado, I would call upon my first faculty. First, I'll introduce him, and then I'll call upon him to tell us about how he got into UK, what was his thought process, and what does he advise to what I believe would be most of the youngsters present here. Dr. Ravi passed out from SDPGI in 2021 September. He is a senior clinical fellow in urology at Warwickshire University Hospital in the United Kingdom. He is interested in urology, academics, research, and leadership. He's part of an upcoming Translate trial, which is a randomized controlled trial for perineal biopsies, and identifies calculator for risk of malignancies and hematuria. He can speak 6 languages fluently, loves singing, traveling, meeting new people. I believe he's married and he has a daughter, if I'm not wrong. Am I
No,
right, Dr. Ravi?
I'm married, but I do not have children. So
Okay, you don't have a daughter, but your Twitter said that, this is what you would like your daughter to do. So I thought you have a daughter.
yeah, no.
So, okay, over to you, Ravi. I would just lay down some ground rules of how the moderation would be. Questions can be directly posted to chat to me, or any questions are there, put it up. I will ask them to Dr. Ravi or Dr. Iqbal, and raise your hands. At the end of the session, we will take up all the questions. Over to you, Dr. Ravi, for the first part of the talk.
Thank you and good evening, everyone. I'm going to share my screen now. So this presentation is going to be about how I started my journey and what are the other ways to get training into the UK and with different fellowship programs. I'm currently working as a senior clinical fellow in University Hospital, Coventry, Warwickshire in United Kingdom. I have no conflict of interest for this presentation. So what we're going to see in next 15 minutes is routes for GMC registration in the UK, because that's the most important part to practice in the UK. What are the essential documents required, which you can gather even before starting the process? What is GMC sponsorship schemes, and important references and links. So before I start, I'm just going to tell you just a bit about UK. So United Kingdom consists of 4 different regions, that's Scotland, England, Wales, and Northern Ireland. Why I'm telling this, because while applying for fellowships, it's different for England, different for Scotland, and different for Ireland. So when you go on a website to find out fellowships, you might need to make 3 different websites to find fellowships in these regions. Although most of the fellowships are in England, but few fellowships or few jobs are in Scotland and Ireland as well. So what are the options to explore your fellowships pathway and how to get into fellowship program in the UK? So one of the program is called Medical Training Initiative, which is most of the people follow after passing their MCH or DNB programs. In this MTI program, a person is guaranteed training because he knows in what kind of program he's going into. He has an access to e-portfolio. He or she doesn't need to pass PLAB or MRCS exam for this pathway. Important thing is, if somebody has passed PLAB exam or either failed PLAB in the past, then he or she won't be able to get into this MTI program. How to apply for this MTI program is there are 2 ways to get a job. Apply for MTI matching program. If you go through RCS website, that is Royal College of Surgeons website, there's an MTI match program. You go through that, you apply, you see what you want to do for your fellowship, which area you want to explore, like andrology, robotics, endourology, whatever area you want to explore. You need to discuss this with your MTI correspondent, and he will find a job for you. And another route by which you can apply for MTI is that you can find a job yourself by looking on NHS websites, and then you can coordinate it with a MTI coordinator. The important thing which you need to know before applying for MTI program is that some of the posts on MTI programs are not paid. You may need to get sponsorship from your home country to get experience from here. And you may need to pay the placement fee, which might range from £1,000 to £1,500. And the visa which you get on MTI program doesn't count towards your British citizenship, because you get a tier 5 visa and not tier 2. Another one is the GMC sponsorship route, which is slightly different from MTI pathway. It also guarantees you training. It has opportunities to attain higher degree. There are options of research in this sponsorship scheme. And just like MTI, you don't need to have PLAB and MRCS. If you have PLAB or MRCS, then, if you have PLAB, then you won't be able to go through this pathway. But if you have MRCS, then it's fine. It's not a contraindication to GMC sponsorship scheme. Again, some of the posts in the sponsorship scheme are not paid. One important thing is regarding the sponsorship. So there's little inconsistent information within the trust. Although many on the GMC website, there's a list of all the hospitals who are supposed to be sponsor, but the hospital themselves are not aware of this sponsorship that they are able to, provide for sponsorship. So you need to discuss it with the trust HR department and your consultant whether the hospital can give you sponsorship or not. For example, this is a part of the list which is given on GMC, General Medical Council website, and these are the hospitals, the few hospitals which give you sponsorship, but many of the hospitals themselves are not aware of this. So that may make the things slightly tricky. The safest pathway is to contact Royal College of Surgeon, and they will be able to help you because they are aware of the sponsorship pathway. And if you coordinate Royal College of Surgeons with your trust, make your things easier. Another option is to directly apply on the jobs which are advertised at fellowships. So the fellowships is sometimes a fancy word, which not necessarily means training. It's more of a job and not training as such, but you can coordinate with your consultant so that you get training as well. For this pathway, you need to have MRCS or PLAB and a GMC registration before applying for this one. And some jobs in MTI and sponsorship pathway can be converted into this later on. As I said, training is not guaranteed because you are supposed to do a job and not training. And as I said, these are merely fancy terms sometimes. And you need to sit for PLAB or MRCS. They are costly because for PLAB, you may need to come to the UK to appear for the exams and another degree. Next one is FISH for a fellowship, which means that this fellowship doesn't exist on papers, but still you can make this happen by contacting few consultants in the UK. If you're interested in a particular subject or if you're in contact with a particular consultant, you can contact him and you can convert a normal job into a fellowship program. And that need to be discussed by you and consultant because it is not present on paper. But the training is guaranteed because you yourself are looking for this pathway, and your consultant will be happy to help you in this. And you have plenty of choices to in this program to find fellowships. And you may be able to convert this pathway either into MTI or GMC sponsorship scheme. Although there is no guarantee of job, but once you get the job through this pathway, the training will be there. And it is not simple because it's not only the consultant who decide for your job, but also the administrative staff and everything. But if you keep on trying, you will get through this pathway as well. So I came in the UK through a GMC sponsorship scheme because at my time, MRCS was not being conducted, or either just part one was being conducted. And it was important for me to come here without wasting much time. So I chose for this pathway. So I will be talking in a few details about this pathway, especially. Although the requirement for this pathway are same as another one. So if you just pay attention to what documents are required in this pathway, that will suffice the other pathways as well, because the documentation is essentially almost similar. So this is important to know what documents you need to support for your GMC sponsorship application, because GMC registration is most important step in doing your jobs over there. If you do not have any GMC registration, it's not going to work anyway. And I would advise to start collecting your documents even before you get a GMC registration from day one without wasting time, so that you can keep those documents for the future applications. First and foremost important part is to get a job through GMC sponsorship scheme, by which this is a screenshot which I took from the NHS jobs. It looked like this. You need to make a profile over there, include your CV, and on the keywords, you just type urology. You will get plenty of jobs on your right-hand side. like the senior clinical fellow, andrology, trust doctor, all the sort of application jobs profiles you can see, and then you can apply each of them. And if you get shortlisted, you will be interviewed, and you will be getting a job. So similarly, I applied for one of these fellowships last year, and I got a job letter from Trust. So the important part after the appearing for interview is to get a job letter from NHS Trust, and it has to be more than ST3 level or above. The levels like ST1 to ST7 are trainee terms, and it should not be confused with a fellowship for international medical graduates. So ST3 essentially means a person should have 3 years of urology experience back home. And that's why this post is for those who already have urology experience, and he can appear for this sponsorship pathway. So you will get a letter, job letter like this, in which it will be written that it is ST3 level post in your job letter. Another important document which you need is your primary medical qualification certificate, which is essentially your MBBS in India, and other primary medical qualification if you're from other country. And you need to see your GMC criteria, whether your primary medical qualification is eligible for it or not. But as far as I know, all Indian qualification, because it's MBBS, so it is valid in the UK. Another important thing is that your primary medical qualification should be verified by EPIC or ECFMG. It is US-based private company which verifies your documents, and the GMC take the reference from ECFMG directly. So you should be able to get your MBBS degree verified by ECFMG separately. This is one of the most important parts. If you don't get your primary medical qualification verified by ECFMG, it's not going to work. Another most important pathway without which it won't be possible for you to get fellowship is your English proficiency. There are 2 exams which are available for proving your English efficiency. One is IELTS certificate, another is OET. I think most of you must be aware of IELTS certificate because it's a very old exam and it's been conducted for the last many years. OET is slightly newer newer variety of this exam, and it's Australia-based exam which UK has started recognizing since last 2 years. I appeared for OET exams. It is slightly easier, I would say, than IELTS exam, slightly costlier, but slightly easier as well. And it's easy to, pass this exam in one go. But important part is you need to pass all the modules like speaking, listening, reading, and writing in one go. You cannot pass it in bits and pieces. These certificates are valid for 2 years. So if you get your English exam cleared, maybe within next few months, and then apply for fellowship, so you have this important thing with you already. So I would advise you to, if somebody of you is planning for fellowship in the UK, so it's better to get your English exam done as soon as possible, because the certificate is valid for 2 years anyway. After passing your OET exam, you need to get minimum B in all your modules like listening, reading, writing, and speaking. You don't need to get an A. It's just a cutoff that you need to get B. So higher mark doesn't mean anything. You just need to cross this limit of 350 marks. Another important is internship completion certificate. Your internship should be acceptable to UK, and as far as my understanding goes, Indian internships are acceptable in UK from whichever college you have done that. Certificate of good standing. So this certificate is important at the end stages when you're near to get your GMC registration. This good standing need to be taken from the medical regulatory authority like MCI or your state medical council, where you have worked for the last 5 years. And you will need to do this even if you're not worked in that country. For example, if you did your MBBS from some other country, and then you got yourself registered in India, but you have never worked in India, but still you need to get certificate of good standing, even if you have not worked. Basically, you need to get certificate from those places wherever you have worked. So your medical council is the authority for that particular state or country. You need to update your CV regarding your recent work and whatever work you have been doing since last 5 years, especially last 12 months. And there shouldn't be any break for more than 28 days in last 12 months. And you should mention this on your CV that if you have any break, the reason should be mentioned clearly, whether it was due to some accidental leave, maternity leave, or paternity leave. You need to mention it. Another important thing is your logbook. So the logbook, which is considered valid by the GMC, is there's a template for it. I'll be sharing the template with you in the next slide. So the surgeries which you have done, observed, or done under supervision need to be mentioned in that logbook, and that need to be signed off by your clinical supervisor or your consultant. So this is how a logbook look like for your GMC application. It is available as a template on RCS website. You can download it from there. And then comes the reference forms. So your reference forms need to be signed by 2 referees, the recent one who are working with you, and your NHS trust, while offering you job, once you confirm it, will send these reference form to your consultants to get some details about you, that how your working profile was, how good or bad you were. I mean, so you need to keep this thing in your mind ready, that you will need 2 referees for this thing. So the pathway they use is called Zinc pathway. They directly send a link to your consultant on their email ID, and your consultant or your clinical supervisor will fill in the details for you to give references. So once you have collected all these documents, this list of documents, the process start, that the RCS or the GMC, they will assess your eligibility once you collected documents. Then you need to submit your application online and upload your supporting documents with your references and information. Then your application will be assessed, and you'll get a GMC registration. Once you get a GMC registration, then you need to apply for visa, and then you're ready to travel to UK. Although it seems that so many things are going on, so many documents, but believe me, it's doable. It's not difficult at all. It may sound that there are so many documentation, but everything is doable. You just need to make a list, be patient, and keep doing if you want to do a fellowship or want to gain experience. To summarize, I'm just going to repeat few slides again to summarize this documentation, because this is very important. Without this documentation, even if you have many publications, if you have been a however good you have been in your career, but if you do not have few essential requirements, essential things with you, you won't be able to get GMC registration. So the first one is your EPIC verification. This is really very important to get your MBBS degree verified by US based company. Another one is English proficiency, IELTS or OET. Third one is your proof of your clinical knowledge. If you have PLAB, then obviously you don't need to go for this sponsorship pathway, but if you have PLAB, you can directly apply for your GMC registration. Next one is your acceptable internship. As I said, Indian internships are acceptable for the UK registration. And in your CV, your activity for the last few years must be mentioned, and any clinical gap must be mentioned, and clinic certificate good standing from your medical councils. These are the references and links to get further information regarding the pathways like GMC, sponsorship scheme, EPIC portfolio, which is ECFMG, OET test, and registration and licensing from the GMC. I would say the word is such a small place, and I mean, the word is essentially a small place in the sense that it's easier nowadays to travel and it's not far. So I would I'm not advise, but this is my opinion, that things should be explored, and there shouldn't be any age limit or anything which should stop you to travel around the world, to explore a world-class health system and get experience. Keep moving forward. And before I conclude my presentation, I would like to just share a few pictures which I have traveled so far in the UK. So I work in a university hospital, which is Coventry and Warwickshire. Warwickshire was birthplace of famous author. And this is my department and few pictures of my department, my colleagues. And this is the view which I get from my hospital on each morning. And this is Edinburgh is the capital city of Scotland. Again, a beautiful city, and London. So once you are done with your fellowship, where to do and what to do next. One option is let's go home and serve your country. Another one is stay here for a while. So if you want to stay here for a while, or you stay here longer, you may need to, or I would say it's almost essential to do your FRCS. And our next speaker, Mr. Shegil, will be telling more about FRCS, how to, what are the essential requirements and how to prepare for FRCS. So good things come to those who have patience and consistency and persistent toward what they want. This is essential in each and every part of your life. And thank you so much. If you want to know more about the pathways and anything, any help, if you want to have for the UK fellowship, you can contact me on your email, my Twitter and my LinkedIn account. Thank you so much. Over to Mr. Shekhi.
Thank you, Dr. Ravi. That was an extremely informative talk. I always thought there was only one channel to go through RCS, but well, I've never been through any of the fellowships or have thought about it. So I was very enlightened. I know of 3 people who went to the RCS fellowship, 2 of whom were my co-speakers at a recently concluded USICon in the youth chapter, Bhavan Rai and Ashwin Tamankar. Bhavan, as most of you might know, is a consultant in UK, and Ashwin came back to India. So as Dr. Ravi pointed out, both the options are possible. And we probably know more from Iqbal sir, how we can settle down in UK if we want to. The first RCS fellowship, one of the pioneers who got it from India is Nikhil Vasdev, who's very well known for his robotic surgery in UK and very well known back in India as well. As I know from RCS website, there are 5 fellowships available in 5 specialities: female and functional urology offering 1 hospital, gender affirmation surgery offering 1, kidney transplantation 1, robotic in 3, and uro-oncology in 5. But Dr. Ravi really opened my eyes to the other avenues being available. I'd like to introduce our next senior speaker, an accomplished author, an accomplished scientific researcher, Professor Iqbal Shergill, who is FRCS Urology and Fellow of European Board of Urology. He's a consultant at the Wrexham Mailer Hospital, North Wales, and Clinical Director, Mailer Academic Unit of Medical and Surgical Sciences, and the North Wales and Northwest Urological Research Centre. His clinical research are minimal invasive surgery, including HoLEP, RISM, UroLift, kidney stones, as well as focal therapy HIFU, and cryotherapy for prostate cancer. He successfully run FRCS urology revision courses over the past decade and edited several educational textbooks, including the famous Viva Practice for FRCS Urology Examination textbook, which I recently came to know is among the 10 most read urology books according to a site known as bookauthority.org. And Sir is an author of 193 publications, has been cited 1,862 times according to ResearchGate. He's written several similar books for people sitting in the FEBU exam and similar exams in USA, Australia, and Asian countries. It's my proud privilege to invite Professor Iqbal Shergill. Sir, over to you.
Many thanks, Dr. Anish, and colleagues, and invite me for this talk. I do apologize, I was delayed on the golf course. Otherwise, my colleagues would have been upset and some of my patients would have been upset as well. So nice to join you now. I'm sharing the screen. Hopefully you can see this one.
Yes, sir, we can.
We can.
Okay. So I'll try to maximize it here as a slideshow. So yeah, many thanks for the introduction. I'll just give a couple of potential conflicts of interest. I don't think they are, but just to kind of introduce them really. At the moment, I'm actually Treasurer-elect and Trustee of BAUS, British Association of Urological Surgeons, and also, as mentioned, a course director of FRCS Urology course, as well as editor of textbooks for Viva practice and also the MCQs. But to be perfectly honest and frank, none of the information I'm going to give is biased towards any of this. It's just general information which is actually available free to share on in the public domain. So what I was planning to do is actually in the next 10 or 15 minutes, essentially introduce you to the JCIE website, discuss about the different parts of the FRCS urology exam, which is essentially section 1 and section 2, give some hint and guidance about the application process, discuss some of the fees and penalties for it, and then some hints on preparation. Obviously, if you have further questions or any further information you require, I'm more than happy to provide that for you. But this is just
Iqbal, sir.
Overview.
Yes, slides are frozen, sir.
Can we make it a full screen? And two, the slides aren't advancing as of yet.
Okay. Apologies for that.
So you have to make it full.
If you can just go to slideshow and make it full screen.
Yeah, I actually tried to, I did do that. So I'm just trying to log out of it as well if I can. Just bear with me a second. I may have to stop sharing and then restart it. And just give me
That's fine. You can do that, sir.
Okay, try again. So I tried to share the screen. Okay, so can you see anything now?
We can still see the same screen, but we can see the slides. We can't see a full screen. We are okay with this, sir. You can continue. It's well visible to most of the people, sir.
Okay, that's okay as well.
Yeah, that's fine, sir. It's going ahead. You can continue with this, sir.
Okay, I apologize for that. I think some issues with my laptop here, or network issues here. So, just moving on to the first part. So this is the JCIE. So that's the Joint Committee on Intercollegiate Examinations, and that's the website for that body. They basically run the exam, give you the idea of how to apply for it, and in the documentation, what they say essentially for FRCS urology, what they expect is that the applicant has acquired the applied knowledge and clinical skills to be assessed at the level of a day one consultant in the generality of urology. So that's the expectation if you're going to pass that exam for the FRCS urology. The FRCS urology, can you see these exam dates as well?
Yes, sir, we can.
We have section 1 and section 2. So section 1 are multiple choice questions and extended mapping questions, and section 2 is Viva. So for section 1, very, very prescriptive. They run the exam twice a year, and these are the exam dates, and they're very, very precise on the deadlines. So you have to meet these deadlines. They're typically 3 months ahead before the examination. Similarly, for section 2, they have exam dates all set out throughout the UK, and that would be Scotland, that would be Ireland, that would be England, and they give a little bit more leeway in terms of application for that one, but the exam dates are set in stone. The actual application process. Now, the applications are changing from 1st January 2023. This is particularly relevant to those candidates who are not on training posts in the UK. So for the vast majority of listeners here today, that will be quite relevant. And on that JCIE website, they've given some guidance notes in this document, the G43 Applicants 2023. And they also have changed the structured reference form, which is the OP29 structured reference form. I'll show you those in the next couple of slides. But in that one, there is some revised eligibility, and I'll go through those points with you. On the website, they very specific in terms of what is required in terms of payment, in terms of structured reference form, in terms of CV submission, in terms of operative experience that you need to submit, show the evidence for this, and also photographic evidence as well. If we take some of these points here, next one is basically, this is the most important thing, which is the revised eligibility. In the old application process, they were quite lenient, shall we say, but now they've become quite strict. And all the issues that they have changed now are written down here. So essentially, if we go through these one by one, it may be helpful. The applicant must have passed the MRCS examination of one of the 4 surgical royal colleges. The applicant must have undertaken a minimum of 4 years of appropriate training in those areas of surgical practice that will be examined, the urology in section 2. And then they also mentioned that a minimum of 1 year of the surgical practice must have been in the UK or Ireland, during which time the applicant must have participated in the mandatory requirements as set out by the GMC. They also talk about during the time spent in UK and Ireland, the applicant must have been signed up to the ISCP, which is the Intermediate Surgical Curriculum Programme, and there is confirmation of competency progression reference to this. This is available. Anyone can actually apply for that one. It's not a problem. Surgical trainees do this every day, but non-surgical trainees, it's not a problem. You can still apply and document and reference all your competencies throughout that process. And then here, the UK applicants, Trust or Health Board's Director of Medical Education, nominated deputy must countersign the principal referee form, which I'll talk about in the next slide. So they've become very, very strict in this respect. Now, with regard to the reference form, this is quite a complicated document actually, and it has to be taken quite seriously because you have to have 3 references there to allow you to be eligible to submit and enter the exam. In the first part, it's the basic demographics, which is documented. And then we have to talk about the referee, and you have to have the demographics of the referee. So that's pretty straightforward. The referee then will complete section C, D, E, F, G, and C essentially is going to be about diagnostic skills. So they have to be matched towards the curriculum. And remember, the referee is always going to have in his mind that the applicant has to be day 1, equivalent of a day 1 consultant in general urology. So diagnostic skills, clinical management skills, section D, and then technical operative skills, and that will be supplemented with your operative logbook. and then comments about professionalism and probity, which are absolutely critical in terms of DMC approval, shall we say. And then finally, they will also be asked to discuss or document communication and language skills. Again, this will all be with respect to all the guidance documents on the actual JCI website. And obviously in this talk, we can't go through every single aspect of that, but that's the kind of starting point to read up about. Then the referee will have to tick all the boxes and then make a signature that, you know, that this is their understanding, their reference for you in terms of application for the exam. Now, fees. It's not a cheap exam, not a cheap exam at all. So essentially, we're looking at £1,904. So section 1 is £552. Section 2 is £1,352. And again, on the documentation, they say you have to pay everything in full. They will basically set up an account for you with regards to the monies in the account. And then this will be then credited, the amount will be credited to you, and then you use a credit or a debit card to pay for this as well. So they've gone into quite a lot of detail regarding fees and the way of dealing with that as well. In terms of penalties and withdrawals, like yellow cards and red cards in football, they again stipulate on that documentation how many times you can do the exam, how many times you can do section 1, how many times you can do section 2. Quite clearly, we have an expectation that most of the doctors will pass, you know, first or second time, but they do document how many times you're allowed to do the exam, over which period, when the penalties can be done, when you can withdraw if you've got medical illnesses or the like. Now, in terms of the final section here about preparation, this is the critical thing really to base your expectation or level of skill the intercollegiate surgical intercollegiate specialty examination, which is the syllabus blueprint from 2016. And that's a very detailed document outlining pretty much every aspect of urology which will form the syllabus for the examination itself. If we move on towards preparation, again, I don't want to be biased in terms of what information I'm going to be giving, but very nice trainees frequently asked questions on the BAUS website. And it's written by one of the recent trainees who passed the exam and qualified. But it's actually quite relevant, and you know, having read it independently as well, I thought it was actually quite accurate in terms of what advice should be given. And again, you can go to the BAUS website and download this information. Briefly, section 1, as discussed earlier, they have 2 exams every year, January and July. Applications close 3 months prior to this. And what they're assessing is basic science and clinical knowledge. And what they do is they have a CBT, so computer-based training centre. In England, they call it Pearson View Centre. And essentially, it's like a computer which you answer all your questions. There's 2 papers, both are 2.5 hours each. Paper 1 is single best answer, so multiple choice. But no negative marking. And then paper 2 is what's called extended matching questions. Now, extended matching questions are quite new and a recent kind of introduction. And we're not always very used to doing extended matching questions, so you definitely need to have a practice in doing these. And I would say for an average person, I think 6 months of dedicated revision time is required for paper 1 or section 1. Now, obviously, we've written the MCQ book for FRCS Uro and graduate urology examinations. I think that's quite a good level of MCQ questions to give you an idea of how easy or how difficult actually the exam is. Obviously, there's more sources as well, which are outlined here. Campbell's Urology, I wouldn't advocate reading it cover to cover for the exam. I don't think it's needed, and it's probably too much. You're better off using it as a reference book. So if there is a doubt as to some particular topic, that you can go and use it as a reference, dip in and dip out of it. Campbell's Urology MCQs, we used them when we were revising for the exams. I think they're a little bit out of date. I agree with that comment. And sometimes the standard of the question is quite complicated and more complex than actual FRCS urology. And as I'm sure some of you already have seen some of the questions and answers, they're a little bit dubious, some of them as well. The scientific basis of urology is probably a good textbook as well, maybe a little bit out of date as well, but it's definitely got the background information that you require in terms of basic science knowledge. And then the other textbooks are written down there, Essentials of Pediatric Urology and the course as well, which is more relevant for section 2, but still relevant for 1. In the UK, we use something called the Oxford Handbook of Urology, which again is very useful in terms of, if you've got a spare 5 minutes, you're in the hospital, you're having a coffee or something, just flick through that and just quickly access some information. Imaging and technology in urology as well. And then I would also, because it is a UK based exam, I suppose is the best way of describing it, EAU guidance, European guidance, and NICE references are NICE guidance is reference as well and have a firm understanding of the overall topic. Then last couple of slides. Section 2 is again twice a year, rotational in the UK, so they will give guidance as to where it's going to be. Edinburgh, we had our exam in Edinburgh. Some of our colleagues were over in Dublin, some are in London. Next one I think is coming up in Birmingham as well. And by this stage, once you've passed section 1, you're definitely going to have the knowledge of section 2. The issue is, how do you apply that knowledge? And that's where a lot of trainees and non-trainees do get unstuck. I'll explain some of the way to overcome that in a minute. Essentially, in section 2, we have a whole set of vivas, 8 tables. Each table has 2 sections to it. So there's uro-oncology, which is kidney and bladder, one table, prostate, testis and penis on another table. And the third table is pediatrics. You'll have 2 tables of that. And then emergency urology, again, 2 sections to that table. And the 5th one is calculi and UTIs, and then subsequently urological imaging and urotechnology, bladder dysfunction and gynae urology, and then the final one is BPH and andrology. Essentially, you'll have 20 minutes on each table, on each viva for that. I think the main advice for section 2, to be perfectly honest, is practice, practice, practice. And then practice more, and practice even more. Because this viva examination is, again, a unique thing in terms of examination technique. And the ones who tend to be successful are the ones who tend to revise and practice in groups. If you're on your own, you find it difficult, because in the actual viva exam, you have to explain things, you have to discuss things in a very kind of coordinated manner. Now, obviously with COVID around, and even to be fair before it as well, to a certain extent, but certainly with COVID, Skype, Teams, Zoom has revolutionized how to revise. It's a real great opportunity because back in the day when we were revising, we used to have to travel 20 minutes, 30 minutes, an hour sometimes to somebody else's place. And, you know, that's very difficult to revise like that and to practice like that. Telephone calls are possible, but again, you lose that non-verbal communication, which is crucial in the Viva exam. So the advice here is basically to take every opportunity you have to practice with anyone. You know, look in the mirror, look at yourself, video yourself, see what your mannerisms are, because non-verbal communication is quite critical in terms of, you know, some question they ask you, you're not quite sure, do you look a bit shaky, or do you look really confident, and take it through the question through that way. Speak to your wives, Viva with your children if you have any. Consultants, they can give you mock Vivas. Junior doctors, whenever you just explain anything to the junior doctors in a way that you're almost explaining something as it's a Viva course. As I said, there's a Viva exam going on. And certainly those who recently passed, they would be delighted to help you with mock Vivas. The level of knowledge and application you get when you do the FRCS exam is the highest you'll ever be. After that, even as a consultant, it's going to be significantly lower. But at that level, these trainees are absolutely enthused, absolutely excited in, you know, giving over information and asking you questions. Spend some time with the radiologists and the multidisciplinary team as well. So, for example, they might ask you, you know, how's a bone scan done? And, you know, if you just read about it, it's going to be difficult to explain. If you've gone there into the nuclear medicine department, you remember, oh, actually, that was the machine. That's what they used, and that's what time they came back. That's the patient experience. You're more likely to give a much better answer. And then final slide. The BAUS website also mentions these other courses as well. And, you know, we were quite happy that they mentioned our course as well on it as well. So it's been running for the last 10 years, a very successful course. Other courses like Europe course, Melina's got a new pediatric Viva course. BAUS FRCS revision course is very good. They do that 6 weeks or so before section 2. And so that gets you, you know, really focused, and then gives you a real push for the last few weeks. There is another course also in London as well, which they can do as well. So yeah, lots of opportunities available there for you. Thanks very much.
Thank you, Professor Iqbal sir. I think a lot of people would have got the technical know-how from Iqbal sir about how to go about the entire process, what does it involve, and where and what are the resources available. Sir, the foremost question that a lot of people have been asking is the difference between JCIE and JCSFE, and whether urology after passing if JCSFE is the same as what we need to go through JCIE.
Tricky question in terms of kind of subjective way of understanding it. But objectively, the main understanding or the main difference that I've got in my mind is that with the JCIE, it lets you, if you pass that exam, that format, it lets you then go for the specialist register and allow you to practice pretty much as a consultant in the UK. And that's the main difference.
So after JCSFE, you would have to come back in all probability. But after JCIE, you can practice there as a consultant.
Yeah, I mean, they're very prescriptive, as I mentioned in that first or second slide, that this is, you know, day one of a urology consultant in the generality of urology in the UK. That's what the expectation is. Exam.
Okay, thank you for that, sir. And are overseas graduates eligible to give FRCS or only by JCIE, or they have to they can do it through JCSFE? I'm sorry to ask that again.
Yeah, so it's, if you want to go for the FRCS urology exam, this one, the JCIE one, then you have to fulfill all the criteria, which are now obviously going to change as of next year. And the JCSF one, I think anyone can go from that one for overseas. I don't have much experience of that route myself, but that's my understanding of it.
And MRCS goes to JCSFE and then it goes to FRCS. Am I right in the chronology?
I think that one will have to, for the JCIE, yeah?
No, what I'm saying is, does it go through MRCS, JCSFE or JCIE and then FRCS?
For the new eligibility for JCIE, yes, you have to have an MRCS there.
Okay, so that answers one question. Another question.
Muted, I think.
I muted myself. For someone who's finishing MCH here and then going to UK, should we get into training again there in UK?
I think you have two options. I think you do have two options. Now, a lot of trainees, MCH from India coming to the UK, it's advantageous if you can get a training number, training post. It's actually more difficult. So equivalence is almost another opportunity. Now, the advantage of equivalence, in a way, is that you're almost based in one kind of hospital, one trust. So you get, high degree of confidence. Trainers will get a high degree of confidence, but the main issue is going to be to have the breadth of experience in that particular hospital as well. So, for example, some of our Indian have come over with MCH, tried for training numbers, but been unsuccessful, then still managed to get equivalence, and probably potentially one could argue even a higher quality of training through that route in one hospital, one trust, and the quality of skills that they've developed potentially one could argue is superior.
Okay, thanks for that, sir. I'm going to ask some of the questions which are going over my head because there are a lot of acronyms out there. For someone who has done training in UK and then clears JCIE, will they get a consultant under CESR route? And if so, any difference in this other than routes like CCT or CESRCP? I'm not sure what the person wants to ask. So Dr. Javed can directly unmute himself if Professor Iqbal is unable to help him out. Professor Iqbal, sir.
I think the question is probably asking that can you still become a consultant with the CESRCs, as we call it here? Essentially, it's an equivalence of training, and yes, you can. And a lot of high quality consultants have now become consultants in the last few years in the UK through that route. We've appointed two in our hospital itself, and one is an expert stone surgeon from Egypt, another one is from India.
Okay. Dr. Javed, I would defer further questions. First, does that answer your question? I am not certain he is there. Okay, it does, according to him. Okay, sir, the next question is, to obtain GMC, is MRCS or FRCS mandatory, or does verification of the MCA degree from EPIC being sufficient?
That I will have to double check for you the criteria because I'm not 100% sure. And I can't give a straight answer.
Yes, so I can answer that question. So basically, the degrees of India, only MBBS is recognized in the UK.
So even if MS and DNB urology aren't.
Even if somebody is having MCH, there is no point in getting it verified by ECFMG because that's not recognized in the UK. So there are few degrees in the UK which are recognized, like maybe MD anesthesia from Pakistan, but not from India. So you need to see GMC website, which what are the degrees which are recognized.
I believe psychiatry is one thing which is probably recognized from India.
I'm not aware of psychiatry, but MCH urology is not recognized. That why.
Okay. Okay.
And psychiatry is
The
not
next,
recognized. It's also not recognized. Yeah.
okay.
It's not
Next
recognized.
question being, if you, any one of you can answer, if you take up a job in NHS, is accommodation provided by them?
Should I answer that question or?
Please go ahead, Ravi.
Yeah.
Right. So there are few trusts which do give you accommodation, but then there are most of the trusts they do not. But even if a trust is giving you accommodation, they are going to charge you whatever the amount according to that city or that area. For example, my trust, it gives accommodation, but that's around 25 kilometers from the hospital. So it's not practical to live in that accommodation. So I have ended up living in the area nearby. So, and the few hospitals, they do not provide accommodation at all, but few of my friends in London, they have accommodation just nearby hospital. So it differs from hospital from trust to trust, yeah.
Okay, I think that helps us. Okay, one question to both of you. How difficult is it to join FRCS after having done MRCS? Professor Iqbal might be able to answer that.
Right.
Yeah, it's FRCS urology is not easy, but given the dedication, given the process, given the clinical experiences, most doctors, most urologists having passed the MRCS are more than capable of passing FRCS urology. And just as an additional point, I think our experience is pretty much all urologists from India have the knowledge, absolutely have the knowledge. There's no doubt about that at all. The main issue becomes in that section 2, where you're trying to explain your thought processes and management of a particular condition and in a logical way. So that's sometimes where the downfall occurs.
Okay, thank you, sir. I have 10 more minutes. So, I'll have from the youth, I have this question, which I would ask to Dr. Ravi. How do you find the right job and the right hospital? How to find whether this is the job you're looking for? I know they are more rhetorical questions, but still, these are some of the questions which people are asking us.
So I couldn't understand the question. I mean, what is the
question? How to find the right job and the right hospital?
Okay.
And so, how to find whether this is the job you're looking for?
Right. So this is a so you need to first figure out what you are looking for, right? And another thing is, for example, if somebody is looking for experience in endourology, and so he should find out the NHS jobs website and find out what are the jobs options available. And for some time, even if the job description is not written clearly, but still you can ask the consultant at the time of interview whether he will be happy to put you in endourology unit for some time or not. Another option is to talk with the colleagues who are already working in that hospital. It will give you an idea that what is the working culture is all about, how much work they are getting. And I mean, and sometimes even after asking, you need to experience it yourself, that whether this was a good experience or not. You cannot always just tick mark everything without even experiencing. But yeah, you can ask consultant, you can ask the person who's already working there. That helps.
I think one important question which I would also ask, and which has been asked by someone, can you give me a brief statement, Dr. Ravi, about the timeline as to when during your MCS should you start looking for this and start working on this?
Right.
When did you start, and when would you advise people to start?
Yeah, so I started in my final year at the time of COVID, because the OTs were shut. So I had practically not much to do. So I started exploring these things. I made a profile on NHS and everything. So I started in my final year of my training. And luckily, I got this my fellowship within 3 months. But I was not expecting that to happen. So it took some time for me, because I had to clear my English exam after getting this job offer. But I would advise to, if somebody is planning to get a fellowship or to get experience in the NHS, he should do two things essentially. One is to get his primary medical qualification verified by ECFMG. Second is to clear English exam. Because if these two things are not done, even if you get a fellowship, you won't be able to pursue that. So you need to do two most important things, sooner the better. So I think the ideal time can be the starting of your final year, so that once you finishes your final year, you are ready to move. It on an average, it take around 1 year, because visa process, and it may take some time. For me, visa took just 15 days, but for one of my colleague, it took 3 months. So it depends on visa also sometimes. But on an average, it takes around 10 to 12 months.
Okay, thank you. I'm going to leave out a few questions which are more specific and directed. We've covered the broad aspects. There's a feedback from Dr. Ravi, and I would like the remaining questions to be put up either to Dr. Kamal or to me or to Shivam sir, or to Dr. Ravi directly, or a Professor Iqbal for that matter, so that they can be answered for your help. Dr. Ravi has already shared his email, and there is a feedback form he shared. So I would be not taking any further questions, as it seems that we have covered most of the important subjects. I would ask Shivam sir to give his concluding remarks on the last 1 hour.
Thank you, Anish, for moderating the session so wonderfully well. So I thank once again Dr. Professor Iqbal Shergill, which probably because of some, I could not interact in the beginning, and Dr. Ravi Bhatia for their enlightening deliberation on the two subjects. So I'm sure our young urologists in India, some of whom might be aspiring for training abroad, particularly in the UK, must have been benefited by these two talks. And as Dr. Kamal would endorse that last time when we had a meeting with BAUS, the Honorary Secretary Ian Pierce, I said that now it's the right time that we need to have more of these global connections. Like we need to leave aside those restrictions of being in one state or one country, and we need to have a kind of a thing that is, we need to have a global school of urology where all the faculty members throughout the world, all residents throughout the world may interact virtually, because this has become so easy. The technology has made it so easy. And in the last 2 years of COVID, this actually was probably a boon to us, that we could interact with so many people from UK also. David Ralph was there, then John Mulcahy was there in many of the webinars, even Nikhil Vasdev, Krishna Setia, Peter Black, so many people came from UK also. And we had so many webinars, almost every week we used to have webinar, and we were improved our knowledge and about all the different subjects on urology, and our residents were also benefited a lot. So I would be looking forward to more such interactions with people from UK also. So thank you once again very much, Professor Iqbal Shergill, for joining us, and Dr. Ravi Bhatia. And thank you, Kamalji, for organizing this webinar. Thank you. So if Dr. Iqbal Shergill and Ravi Bhatia have there any last comment before we wrap up the session, please go ahead.
Just very briefly, many thanks for the invite, and it's certainly an opportunity, I think, for quite a few of you. If you want to come over to UK, we'll be more than happy to help and support as required. And we're always on the lookout for good urologists in the UK. So I'd be delighted to try to help you out. Thank you very much.
Thank you, Dr. Shergill. Dr. Ravi.
Yeah, thank you so much for this talk and for this organizing this webinar. I'm ready to help anybody who want to connect with me. I've given my email ID. If somebody is having any doubts or question, he can ask me. I'm ready to help. And as Mr. Shergill said, that we are constantly, UK is constantly looking for trainees and for the urologist, and the support and the help which we get from is commendable. I have nothing to complain about this place so far. Yeah.
Thank you, Dr. Ravi. And I will just request Dr. Kamalji to give a vote of thanks and then wrap up the session. Thank you very much.
At the onset, I would like to thank Professor Shergill. I'm sorry, sir. I publicly apologize for the goof up I made up in the mentioning the dates. I'm very thankful to him. Even on a very short notice, he could prepare such a wonderful talk. Ravi, as usual, is very helpful. He's just like a younger brother to me. And with the support from Dr. Anish and Professor Shivam, I think so. This webinar was conducted in a very well mannered, in a very well structured way. I'm thankful to both the presenters, Dr. Anish and Professor Shivam also. I request everybody to please fill up the feedback form, and we hope to organize many such webinars in future also for all of you under North Zone Society. We look towards BOUS also to join us in this endeavor. Since Professor Shergill is going to be treasurer, I may be disturbing him a little bit. I apologize at the start itself. And with the permission of the chair, the president, sir, I would like to close the session, sir. Thank you.
Thank you. Thank you once again. Thank you.
Okay.